Intravenous pyelography, excretory urogram. Intravenous pyelography is the rentgenographic visualization of the kidneys, ureters, and bladder by injecting a dye into the vascular system. It involves intravenous injection of a radio-opaque dye, example Conray, that is filtered and excrete through the kidneys into the urinary tract. Pyelographic studies reveal the position, shape, and the dimensions of the kidneys, anatomic peculiarities of the urinary system, such as horseshoe kidney, polycystic kidneys, hydronephrosis, double ureters, displacement of the ureters, enlargement of the prostate gland, tumors, renal calculi, abnormalities of the urinary bladder, etc. Procedure: the client is placed in a supine position on the X-ray table. Initially a KUB film is taken. This helps to assure that the bowels are clear enough to continue with the rest of the procedure. It also screens for calculi in the kidney, ureters, or bladder. Then the radio-opaque dye is injected intravenously. Films are taken at 5, 15, and 60 minutes after the dye is injected, or even more frequently. Post-voiding films also may be taken to see the functioning of the bladder. Nursing implications: 1. Prepare the client as for a plain X-ray abdomen. 2. Explain the procedure to the client to relieve his anxiety and worries. 3. Before the client is scheduled for the test, ascertain whether the client is sensitive to iodine compounds, because the radio-opaque medium containing iodine when injected intravenously can cause anaphylactic reactions in hypersensitive individuals. 4. A history of allergy. Serious kidney damages, liver diseases, cardiac arrhythmias are contraindications to the use of radio-opaque substances. 5. The client should be watched for any untoward reactions during and after the procedure. The complications that are to be watched are anaphylactic shock, acute renal failure, electrolyte imbalance, and cardiac arrhythmias. Since the radio-opaque dyes injected into the clients may cause serious reactions, the nurse, under no circumstances, injects the drug to the client. This is applicable to all dyes. It should be done by a doctor. If the client develops any signs or reaction, the procedure is stopped immediately and the client should be resuscitated. The nurse should be ready with the emergency drugs and equipments to resuscitate the client.